I'm Anthony Bracken. I was born in Philadelphia, Pennsylvania. I was one of 7 children. There was 5 boys and 2 girls. I went to school locally at LaSalle High School and then went on to LaSalle College. And then I went on to medical school at Temple University, which is also in Philadelphia. After spending most of my life in Philadelphia, I thought maybe it was time to branch out a little bit, and I was accepted in a internal medicine residency at Medical College of Virginia in Richmond. I decided while I was a resident that I wanted to subspecialize in cardiology, and I was accepted in a cardiology fellowship at the University of Pittsburgh. During my fellowship there, I was trained in all the basic cardiology disciplines, but I decided that I was more interested in working in the Cath Lab, and I stayed and I did an extra year learning how to do angioplasty. There weren't any stents at the time, and doing advanced heart catheterization work. After my fellowship, I took some additional training, and I, for a period of time, was doing angioplasty and stenting of arteries other than the heart. Dr. Serna, my partner, will be doing that as part of our practice here. Between the two of us, we have over 35 years of experience doing heart caths and interventions. Dr. Serna will be doing our peripheral interventions, meaning doing balloon angioplasty and stenting of arteries other than that in the heart, meaning arm arteries, kidney arteries, and arteries that go down into your legs. Aside from having a state-of-the-art cath lab that we just opened, there's also peripheral vascular equipment in radiology that's about a year old. That's very good equipment that the peripheral angioplasty and stenting will be done there. Cardiac-wise, we will be able to diagnose any cardiac problem using our equipment here and our experience. And if someone has a blockage that we think is amenable to an angioplasty or a stent, fitting within our criteria that we have, we will be doing that in our new cath lab here. A balloon angioplasty is a procedure where over a wire that is down in one of the heart arteries, a balloon is threaded over the wire, and then it's inflated at the site of the blockage. And the balloon crushes the cholesterol plaque against the wall of the artery. We usually don't do many standalone balloon angioplasties anymore. We usually use a stent. A basic stent that we use in the heart starts out as a cylinder of stainless steel, and there's some other materials that are used, but basically it's stainless steel. Then a laser is used to etch out the design of the stent struts. It is then compressed onto a balloon, and when we deploy it, we inflate the balloon, and the balloon expands the stent, which basically looks like a cyclone fence once you expand it that's wrapped into a cylinder. There are bare metal stents, which were the original stents, and now there are stents that are covered with a drug that prevents scar tissue from growing back in through the stent struts to prevent the stents from reblocking. We have a most recent model state-of-the-art GE cath lab. It's called a flat panel. Everything is digital. There's no film involved anymore. Due to the changes in the technology, the amount of radiation that someone gets during a heart cath because of the newer equipment is reduced. We also have the ability built right into our system to do an ultrasound of the heart artery. Over a wire, we place a little catheter that images the cholesterol plaque or the inside of the artery through a little ultrasound crystal mounted on a balloon catheter, or not a balloon catheter, just a regular catheter. So we can, in an artery where we're not sure that the blockage is significant, we can go in and actually measure the amount of opening in an artery directly using the ultrasound device. We also have another system that's built right into our equipment where we can put what's called a pressure wire down into the artery, give a medicine to dilate the arteries, and then by using a ratio of the pressure drop across the blockage, we can determine whether that blockage needs to be fixed. And there's recent data available that using a pressure wire to direct whether you should fix an artery shows a significant benefit to the patients long term. The Sanger Clinic is a practice that was started over 50 years ago by Dr. Paul Sanger, who was a vascular surgeon. Through the years, initially there were just surgeons in the Sanger Clinic. One of the most famous surgeons, Dr. Francis Robacek, who's one of the pioneering cardiac surgeons in the world. It then evolved into having cardiologists on board, and then additional cardiac surgeons and also vascular surgeons. We also have a pediatric cardiology division. So we're probably about the third largest cardiovascular group in the country. We have 8 to 10 pediatric cardiologists, 4 or 5 adult heart surgeons, 2 pediatric heart surgeons, 5 vascular surgeons, and over 50 adult cardiologists. So we can do anything from an echocardiogram to a pediatric heart transplant to an adult heart transplant. We're affiliated with Carolina's healthcare system, and also we're involved in a multitude of research projects through all our divisions. So our group can do anything that needs to be done cardiac-wise, from infant age to octogenarians. If there's ever any question with any patient that we have, I know that by just making a phone call that I can be in contact with one of my partners who may be a subspecialist in that area of cardiology that I can consult with, and we can figure out the problem. Although we are experts in taking care of patients with blockages in their either coronary arteries or their peripheral arteries, we do like to counsel our patients concerning modification of risk factors to decrease their chance of having to have a procedure. The most important thing that I would recommend is that they stop smoking. That's the single most reversible risk factor that you have. Other things that need to be taken care of are control your blood pressure. If you have diabetes, watch your diet and make sure your blood pressure or your blood sugars are controlled, and you need to exercise. You should also have a screening cholesterol profile done to see what your risk profile is, and then you can, through diet, exercise, and medical treatment, you can significantly lower your risk of having a heart attack, stroke, or peripheral vascular disease by treating your cholesterol.